Lovely, welcome. Wow, what a warm-up act. Now we're going to put it all into practice. So I work for the PHC and I'm here to tell you how we've been scaling up type 2 diabetes remission using our health coaching service, the Lifestyle Club. Does that work? Yes. So let's start by thinking about what is currently available for people with diabetes. And if you have pre-diabetes, so your blood glucose is starting to go up, then Healthier You is available. And that is face-to-face or digital interventions with 9 months of follow-up. And that they've shown a reasonable amount, a respectable amount of weight loss, 2.3 kilograms. Slightly disappointing on the HbA1c reduction, but something nonetheless. Then if you've got type 2 diabetes, you might be referred to the Healthy Living programme. And that's a self-management app. And at 12 months, they show a really disappointing 0.8 reduction in HbA1c. But there's also the Desmond programme, which has been running since 2004. It's a face-to-face, one-day intervention and much more respectable, almost 3 kilograms weight loss, 9 millimole reduction in HbA1c at 1 year. So actually, just before I move on, just to point out that there was a study to show that actually after 3 years, that 1 day of intervention, really there's no difference between the people that did the course and the people that didn't. Both of those programs use the current dietary advice, so low fat, high whole grain carbohydrates, and no specific emphasis on remission. Then we've got the Diabetes Path to Remission program, and as Roy's explained, it's a 12-week meal replacement followed by 8 months of follow-up and support, and they do have fantastic results, both at 12 months and now we hear at 5 years as well. However, they do restrict the age of the people that can join, so maximum of 65 years, and you must be diagnosed within 6 years to be able to do the program. It's also quite expensive, at over £1,000 per person, and it is still ultra-processed food, so these people are going to need to have support and help to change their diets and actually to be able to select the right foods for going forward. So let's think about the options for remission. So this study that was published last year in the Journal of Human Nutrition, so it was the British Dietetic Association and Diabetes UK getting together with a lot of representation from the PHC as well. And they wanted to look at dietary approaches to remission. So they compared the low-calorie soups and shakes, the low-carbohydrate diet, and also the Mediterranean diet. And they concluded that remission must be the treatment goal, that even if people don't achieve remission, they will improve the outcome amazingly. So it's worth them giving it a shot. That low carb is absolutely safe and effective and equally good as the other methods. So no reason why people shouldn't be given a choice. It's down to the patient to say what's going to work for them, and they should be able to choose. Ooh, there we go. So you've all heard about David's amazing success with the low carbohydrate diet, but the PHC charity has a huge amount of expertise. We've got doctors, nurses, dietitians, nutritionists. They've all been using low carb with their patients for many years. Some have published papers on their results as well. We've also got PHC ambassadors who have put their own health into turned their own health around, and they've been running free patient support groups, just really wanting to spread the word and to tell people what they've done and to help other people improve their lives. So the Lifestyle Club then was really an opportunity for us to try and scale up what the PHC have been doing all these years, and it was made possible by a generous donation by Steve Bennett. So we've taken that money and we've put it into practice. So this is exciting for me to be able to share what we've done. Right from the beginning, we wanted this to be a service for primary care. So we like the idea that the patient is with their GP and that we're coming in, helping and providing all of the support and the advice to get them to be able to improve. So the GP refers patients or signposts patients to our booking website, and then they'll book onto an information session. So in the information session, we tell them all about the course, the benefits of coming and how to enroll, and over 80% of people will sign up once they've come to one of those sessions. We've developed a fantastic course, and we've partnered with Expert Health. So you might have heard of Expert. They've been delivering structured education programs for many years. They're already adopted by the NHS, and they've helped us produce this fantastic 8-week course. Each session is 90 minutes, so it's a good amount of time to really sort of talk about what you've done in the previous week, talk about the topic of the day, give a bit of discussion on goal setting for the week ahead. All our sessions are delivered over Zoom, and that means that participants can choose the day and the time to suit them, and they all Zoom in from all over the country in their little groups of 12 people. So on the course, we talk about the physiology of diabetes. I think David sort of expressed how important that is, that people understand what's wrong with them, so they're motivated to actually make a difference. We talk all about the low carbohydrate diet, because our health coaches are really experienced with using it, so they know all the hints and tips and can signpost people to recipes and websites that are really useful. We do goal setting, we talk about exercise, stress and sleep, and intermittent fasting. It's a really comprehensive course, and because it's running for 8 weeks, there's plenty of time for people to really experiment and find out how this is actually going to work for them. Fantastic resources. We've got some TLC handbooks, which I haven't seen yet, but I'm hoping we've got some copies somewhere for you to see. Please don't take them away. You know, if you join up with TLC, you will be given your own copy to look at. We do a WhatsApp group for each class so that the participants can keep in touch with their health coach and also each other, motivating each other, sharing what they're eating for breakfast, talking about recipes and so on. And support is really key. I'm going to talk more about that in a second. So we started our pilot in June 2021, and we utilised our network of PHC GPs, so people that were already quite keen with the low carbohydrate approach. So 30 surgeries took part and sent patients to us. We had 4 health coaches, and we managed to run 25 groups, which was for 214 participants. And then at 3 months, we were really pleased. I can only see the edge of it, but 4.5 kilograms weight loss, really good waist reduction, so showing that that visceral fat was reducing, and 8.5 millimole HbA1c, and that's reporting on half of the participants that took part, so that's quite a good sample size. So now we're almost 2 years on, and we've got TLC in 37 surgeries around the country. That's across 7 PCN. We've now got 7 health coaches, and over 600 people have taken part. Really good attendance. Most people attend 7 or 8 of the 8 sessions, and if there is somebody that's only come to 2, I'll phone them up and say, you know, please do give us feedback. We're really small, we're growing, we'd like to know what the problem was. And they'll say, oh, just had a terrible time, my mother was taken into hospital, can I do the course again, please? So I've yet to find somebody that really didn't enjoy it. How do we pay for it, I'm sure you're asking. So we've been able to utilise the additional roles reimbursement scheme, and this was set up by the NHS to help surgeries to employ additional staff, but you can actually use that money to reimburse the TLC services. So without having to go through the overhead of recruiting and employing your own staff, you can pay on a monthly basis and then claim that back as well from the NHS. So looking at our participants, mostly they had type 2 diabetes and pre-diabetes. Some others did slip through, and people with type 1 did incredibly well, particularly people that needed to lose weight. I did have somebody who's been type 1 diabetic for 70 odd years and has the best HbA1c that he's ever had in his life. Age range, youngest 24 years, oldest 86 years, mainly between 55 and 74. But also I'd like to point out that 30% were diagnosed within that year. 20% had been diagnosed more than 10 years ago. So we've really taken everybody. We haven't excluded anyone based on their age. So at 6 months, we can report almost 4 kilograms weight loss, good waist reduction. I'm really pleased with that -12 because that is a definitely clinically significant reduction in HbA1c, and that's just looking at people with type 2 diabetes. Oh, there we go. So pre-diabetes, they did really well on weight loss. I don't think there's any specific reason for that, but they lost average of 7 kilograms, -14 around the middle, and then again a clinically significant HbA1c at the end. But actually, it's that result I'm particularly proud of because that's showing that at the end of 6 months, the average HbA1c is within the normal range. So looking at TLC compared to the existing services, you can see that we've done incredibly well on all of the markers, and we are cheapest too. So we only charge £150 for the handbook, the 8 sessions, and lifetime support. We've got excellent results, we have fantastic participant feedback, and we're really cost effective. And also I'm really proud to say, I can't say we've got it yet because it's in motion, but in a matter of weeks we should be able to say that we have the Kismet accreditation, which obviously, yes, is quite an achievement, but haven't got it just yet, that will be coming. This, I've just borrowed David's slides and he's shown you enough of this already to realise that support is absolutely key. So we take support really seriously, and I think because we're a charity, I'm confident that we can scale this up. We've got a network of volunteers, all absolutely keen and happy to help. Currently, we do monthly catch-up sessions, and that gives us an opportunity to go over topics that were on the course. We have guest speakers. The bigger we're getting the most amazing guest speakers. We have Zoe Harcombe coming for our birthday one next month. We want to set up local support hubs. All of our courses are done via Zoom, but now we're getting pockets of people around the country that have been through TLC. We want to be getting them together and doing things on a local level. So generally, we just see the support can go on and on. It's a club, people join, they'll never be asked to leave. They can stay as long as they want. What about remission, I can hear you say, because that was what my talk was meant to be on. As TLC, it's really difficult for us to report on remission because we have no control over the first blood test that people have before they come on the course to get a baseline, and then subsequently, once they've done the course, we don't have any control over their blood tests after that. Also, the deprescribing, the doctors that we're working with, we're obviously encouraging them to deprescribe, and I think the education thing will come as we're able to run courses for them. But I'm sure many of our participants are on medication where they don't need to. But I can definitely show you some success stories. We've got John, we've got Deborah, also in remission. We've got Kevin, and we've got Mark. You know, loads of people that we can show you that have turned their life around. When I did a quick questionnaire last year, 43 people thought they had reversed their type 2 diabetes. 59%, did I say people? 43% of our participants thought. 59% of the pre-diabetics were now in the normal range. So I'm almost there. Really excited that the University of Surrey have agreed to partner us to run a trial on TLC. They're really impressed with our preliminary results, but we sort of need to be able to show this in a much more robust and statistically significant way. So we want to be looking at what are our results for type 2 diabetes, what are the medication changes that are going on, and what are the factors that predict that somebody's going to be really successful on TLC. So what I'm going to be doing next then is asking for your help, because, you know, TLC, we've literally come from nothing in 2 years. We've had a fantastic start, but as the funding is starting to run out, unless we can expand what we're doing and cover our costs, we're not going to be able to carry this on. This slide, I woke up at 3 o'clock this morning and thought, this isn't really getting across my passion of why I'm doing this. So I found that on my iPad this morning. And it's my parents with my kids in 1998. And it's around the time that my dad was diagnosed with type 2 diabetes. And we were in Suffolk, we were visiting my granny. She was very much alive. She was living for another 12 years. She died at the age of 99 in 2010. My dad, sadly, only lived another 6 years after that. And I just think that healthcare practitioners, you're so tired, you're so sort of trained in this way of medicating people. I just hope you can see what we're offering here, in that really this is going to be down to you whether we can take TLC to the next level. So just to summarise then, please help us to help you. You know, this is about offering lifestyle change over lifelong medication. We need to grow TLC to survive, so we need surgeries to commission us. Use your R's, underspend. Just do 30 patients. We'll just give it a go, but we need to get the throughput to make this work. And we've got to get this data to show the NHS, to show the government that this is something that could work. It could work across all of the methods that people choose to reverse their diabetes, but we have to have the support, and a charity has to be the place to do that. Thank you very much. That's all the things. So play the film. That's all my contact details. Oh, can you? Yeah, can you play the film? Okay, can I sit down?
When it was actually diagnosed that I had type 2, I didn't want to believe that I had it.
I felt absolutely decimated. I hadn't had any illness, I was fit, strong, and all of a sudden that had gone.
My HbA1c blood test came back as really high, and my medication was up.
I had HbA1c figures around 40 to 42, and I knew I was sleepwalking into full diabetes.
I thought I'd been in control, and I hadn't.
I'm Helen Gowers, and I manage the Lifestyle Club, a service for people with type 2 diabetes that's been created by the charity Public Health Collaboration. We've created a fantastic course. Over 600 people have reaped its benefits, and many have reversed their type 2 diabetes completely. We've been working with surgeries across the UK to ensure that our health coaching service complements their skills.
TLC is an opportunity to get to the root cause. Patients not only feel better, but they can realistically reverse their diabetes into remission. This means improving all the figures that we measure, and it's a much more positive experience for me as a GP, improving the health and well-being of my patients.
And thank goodness that they did refer me, because it's the best thing that's ever happened to me.
The Lifestyle Club is based on the low carbohydrate approach pioneered by Dr. David Unwin, one of our charity's founding members.
We're getting an average improvement in hemoglobin A1c of 21 millimoles per mole. I think that's absolutely amazing.
It makes you think about things in a different way. It explains things so that you understand them. It doesn't feel like a faddy diet.
My desire is to be able to get this diabetes on remission.
My HbA1c score has gone down from 47 to 34, which is bang in the normal range. Absolutely fantastic.
The University of Surrey will help us run a trial in Guildford, and we're raising money to pay for it.
And for the NHS to actually commission this, it needs to be done in this unbiased way, and so it can be compared readily with the other programmes that are currently available to people that have type 2 diabetes.
I think that everybody should have the opportunity to do this course. So yeah, I think TLC should be rolled out across the board. I think all the surgeries should be promoting this now, not just the few.
I think TLC is an immensely promising programme.
Let's get the country eating real food to prevent and reverse type 2 diabetes. Support our research so we can prove that this is best for patients, best for healthcare practitioners, and will save the NHS one person at a time.
You know, the whole of my life sort of is just lifted by the way that I am now.
Our vision is for TLC to be the first choice for diabetes, informing and supporting people to better health. If you believe that the NHS should offer a real food approach, please donate and share our video now. Thank you.
But basically, yeah, so we're running a GoFundMe to run this study. The target's £50,000, so we need as much help as we can get, basically. Amazingly, an anonymous donator has come forward to say any donations made over this weekend, they will match up to £5,000. So we can actually turn £5,000 into £10,000 like that.
I think we're up to 1,000 already.
We're up to 1,000 already, there you go. So amazing.
TLC.
Great. Amazing. So if you go to gofundme.com/TLC study, have a look. If you want to help support in any which way, £1 or £1,000?
But also
£1 to £1,000.
everybody,
Yeah, and then
crowdfunding.
please share it with everyone that you can.